So here we go. All right, well, thank you guys for joining us tonight. We are going to be talking a lot about implants and answering questions, and I'm going to go over a lot of different scenarios and things that we can do with our implants and this New Teeth Now procedure. So we're going to jump right into it. I know that everybody's got things to do, and it's a beautiful Tuesday night here in Florida, so we'll jump straight to this. All right, so a little bit about me. I'm originally from Kentucky, did all of my school at the University of Kentucky, and then I did my surgical residency at the University of Florida. And a very important thing that you're going to hear me say tonight is that I am a board-certified oral and maxillofacial surgeon, and that's really important when you start thinking about a procedure, something like this, and for that matter, any type of surgical procedure, but specifically this New Teeth Now procedure. Whoever would be putting implants in and doing, the reconstruction with implants, it is important to make sure that that person is board certified, whether you come to see me or go somewhere else. It's kind of the way that we hold each other accountable and make sure that everybody's practicing medicine and dentistry up to the same standards. So just make sure whoever is treating you is a board certified oral surgeon. And speaking of that, we have several board-certified oral surgeons that are part of our New Teeth Now group, and you can see them here. Dr. Richards, of course myself, Dr. Vorwald, Dr. Nunez, and Dr. Sharafi. And not only do we have a lot of surgeons doing this procedure with us, we have some different locations. And we're all, part of the same New Teeth Now group, but we're in different locations, and we cover Lakeland, Florida, San Diego, California, and the Villages, which is just a little north of Lakeland. And with questions, as you guys come up with a question, or if I mention something and you want to ask a question about what I'm talking about, just submit those in. There should be a little chat box that you can click on and submit the question, and then I've got some people here that will alert me when a question comes in, and we'll answer those kind of in a timely fashion. So don't be shy, definitely submit those questions. So the other thing besides board certification are these key differentiators. And zygomatic implants, I'm going to speak on those tonight, as well as general anesthesia. And what the zygomatic implant is, it's very common for us to see patients who have been other places. They've been to 3 or 4 other clinics for opinions for implants, and they've been told consistently that they do not have enough bone to place implants. That's usually dealing with the upper jaw. And with the zygomatic implants, they pretty much make it to where I can treat any patient from a bone standpoint. Since I've been doing this procedure in 2007, I have yet to have a patient come in that needed something like this and didn't have enough bone, especially with having the zygomatic implants as a tool that I can use, that I could not do the procedure on. The only patients, and it's been a very, very few, that I've had to turn away were from medical reasons. They never could get the clearance, or they were not healthy enough to undergo the general anesthesia for this procedure. And the general anesthesia is one of the differentiators here. So we do this under a true general anesthetic. We have a separate anesthesia team that's kind of monitoring that. They're doing the anesthesia portion, I'm doing the surgical side. And so you've got 2 teams watching you during the procedure. And that is how we feel is the safest way possible to not only do the procedure, but also do this procedure where the implants can be placed in the most correct position, pain-free. So you go to sleep as you are, you wake up, and the procedure's done. And we do have some questions rolling in, so let's go ahead and answer some of those. All right, so can I get zygomatic implants without going under general anesthesia? Well, I probably answered your question a few seconds ago, but no. So the general anesthesia is very important, especially with any of the implants doing the full upper and lower, but especially with the zygomatic implants. The recovery is pretty much the same whether I'm placing zygomatic implants or traditional implants. But placing those, it'd be very difficult to get. I can get you numb where you wouldn't feel any sharp pains, but just the retractors and kind of stretching the cheek out, I can't totally numb that. So you would feel me stretching some of the cheek out, and you would want to turn your head the way I'm retracting the cheek, and which would limit me on where I can place these. And it would force me to cheat a little bit more away from the ideal position, and you wouldn't get the best results. So I don't even try to do that. I have done the procedure under a sedation, or one of these procedures I did under local, and that was my first and last time to ever do that, because I didn't feel it was fair to me. It wasn't fair to the patient, and it's just not the right thing to do. And I would not ever subject one of my best friends or family members doing this procedure under local anesthesia or even an IV sedation. It's just not safe. And then another question says, I have several teeth that the tops have broken off and the gum has overgrown and covered the root. Will that add unusual complications to getting the procedure? Absolutely not. So a lot of times, if a patient has, we see patients that fit a couple different categories. There's really three main categories of patients that I really end up doing this procedure on. And it's patients who have been missing their teeth, they've had dentures for years, and they're very tired of wearing and dealing with a denture. So they come in to see if they are candidate for this procedure from a bone standpoint. So people with no teeth, we do this procedure on. People who have a mouthful of just decayed teeth, so a lot of cavities, and it's more of a tooth problem, and they don't really have periodontal disease, which is the gum disease where the bone starts shrinking away. It's just purely somebody who typically fits the bill of sipping on Mountain Dew all day long, every day for years, and it just ends up breaking down the enamel, and the teeth get soft, they decay easy, and they end up breaking off, and the roots are still there. And then the third main type of patient is someone who has just their teeth look okay, but they have severe periodontal disease, the gum disease. And if you're going to pick one of those three types to fit in or categories, it would be what you're asking with the broken off teeth and the roots are still in the bone, because usually if the roots are still there, then it means the bone is still there. Because when you take the root out, the body's really smart about getting rid of things it doesn't need. So when the roots come out, the bone starts shrinking away. When you have bad periodontal disease, the bone is pulling away because it's pulling away from the tooth roots to try to spit them out like a splinter. And that's how your body's trying to heal itself. So with broken roots that are, even if the gum is overgrown, usually means there's still pretty solid bone underneath, and definitely you would be a candidate for this procedure. So the way we do this and how these implants are placed, typically we consider the gold standard for the upper jaw, which is called the maxilla, is 6 implants. And you can see they're kind of ghosted on this image so you can get an idea of where they're placed. But we typically do 2 in the front, 2 on the side, and 2 in the back in the molar. And that gets these implants very evenly spaced out. So it's very, very supportive for this 12-tooth bridge. So the bridge goes from first molar to first molar, which includes 12 teeth. And then when we do the lower, very similar to the upper, there's typically 4 implants is considered gold standard. But if a patient has enough bone and room above and around the little nerve that runs inside the jaw, and if you come in for a consult, you'll see that because I'll find it on the CT scan and show you where it's at, and they would look something like this if you have enough room for 6. 6 is not necessarily better. More is not better. 4, if you read most of the literature, that's gold standard, so we typically do 4 on the bottom. The reason that we do more on the top and consider 6 to be gold standard on the upper is there's a big difference between the bones. So the lower jaw is the only bone in the face that moves. So it's a hard, thick, dense bone because it needs to be. The upper jaw is a lot softer bone, It's a little bit more spongy, so you really need more support to make these bridges last for years and years and decades as they're intended to do so. So this little video shows the zygomatic implants. So they're a little longer and they anchor into the lower part of the cheekbone. So we basically get to bypass any areas where you do not have enough bone in the upper jaw, because the sinuses are in the upper jaw area, the floor of the nose is in the upper jaw, and if there's not enough bone because the bone is kind of deteriorated from periodontal disease or just missing teeth, then no longer do we need to do these elaborate bone grafts and take bone from your hip or your lower leg and kind of pack into your sinus. We can place these zygomatic implants. The huge benefit to that is you don't have to have the procedure for the bone graft. We don't have to wait the 7 or 8 months for that bone graft to heal and harden enough to place regular implants. But the real, the benefit that in my mind and what I talk to patients about is anytime I can put an implant into bone that you grew and developed, instead of bone I'm trying to pack somewhere and make you grow for a bone graft, it's always stronger if I can use bone that you've grown and developed on your own. So that's what I do. That's what I would want. If I ever needed this procedure and I didn't have enough bone, I want the zygomatic implants. No one's really going to do a sinus lift and bone graft on me, and that's just my personal belief and philosophy of practice. So this patient, I will show you quite a few before and after pictures. And this young lady, she came down from the northeastern United States and she flew over, who knows how many oral surgeons to get to us, but the reason she came here is because of the zygomatic implants. She had been to some different, clinics close to in the town that she lived, and she'd been told that she didn't have enough bone for implants. She had this gigantic bridge that you can see on the picture, but the bridge was failing. This bridge was only being supported with 5 or 6 natural teeth, and those teeth started to break down. So the bridge, you could literally move it around with your fingers. And she did not want this thing to fall out and just had a total fear of losing this and not having anything there and would be basically toothless. So she came down after doing some extensive research and she Googled what do I do if I don't have enough bone for implants? What's alternatives? And she stumbled upon Zygomatic Implants and our website. She called, scheduled a phone consultation, and then we brought her down, and she had plenty of bone to do this procedure. It was very straightforward, and we were able to do that and get her into basically her ultimate goal of a very nice, healthy smile, all on implants. And here you can see her after. She wanted big crowns and very white, and they look fantastic. I say that she wanted the big teeth. She wanted them to be Hollywood white, and that would be always my preference if a patient asks, but they're your teeth, and these things are made custom. We don't have a small, medium, large set, and we don't have just one color. They really do customize these for every patient, from the size, the shape, the color. They're all custom for you as an individual. And you can see on her x-ray, there's 4 traditional implants, 2 in the front, 2 on the side, and then the ones that are kind of angled, going opposite direction of everything, those are the zygomatic implants, and those are anchoring into the lower part of the cheekbone and giving her a tremendous amount of support in a very important area, which is the molar area where you do most of your chewing force. Yes, we want you to have support on the front teeth so you can bite into an apple or a sandwich, but really when you're putting a lot of the force with the muscles of mastication, the chewing muscles, we want you to have good support on those molars so you can eat the things that you're happy eating. And I think we had a couple other questions come in. Okay, so let's see. So when you would use the words traditional implants, what's the difference between that and a zygomatic implant? So a traditional implant is one that we put in there. They can go as small as like 10 millimeters, and they are ones where we put in just if a patient has enough bone for regular implants. When you do not have enough bone for the regular implants in the upper jaw, that's when we use the zygomatic implant. So zygomatic implant, it looks like a regular implant. It's just longer, and it anchors into the lower part of the cheekbone, which is called the zygoma. So the zygomatic implant instead of the maxilla or the mandible. So that's a good question. And then on have no bone left on the bottom. So there are some things that we can do when patients really have a thin lower jaw, but I have never had to do anything except traditional implants on a patient with the lower jaw. The lower jaw can really resorb down, and when it gets down to the very lower part of the jawbone, it's a really hard part of the bone, and that usually does not resorb. And there's usually around 10 millimeters of bone that I can put traditional implants in. So that's typically not a problem. And then the last question that came in, you guys are active tonight, I like this. Some of my teeth are loose and some are not. Would you pull them all out prior to implant surgery or during the implant surgery? What is your protocol? So if the way I talk to patients, if you've never been here and you are not sure and you haven't scheduled a consult yet and you have a tooth that gets infected, swollen, really painful, you've got to go get the tooth out before just as soon as possible, because those can blow up and get really, really bad from an infection standpoint. But if you're not having a lot of symptoms and you are thinking about a procedure like this, then definitely come see me for a consult first, because if you're going to be doing this procedure, especially here with me, I really want to be the one to take your teeth out, because I know when I'm taking the teeth out, I'm going to be very gentle to the gum tissue, and I'm also going to be really gentle to the bone, because that's what I'm going to be placing the implants in, and the gum is what I'm going to be suturing or putting stitches in, and I want that to be as perfect as possible. If you go somewhere else just to get your teeth out, they may or may not be real gentle with that, especially with the gum, and just kind of take the teeth out really quick because they just want to, move on to the next patient. And sometimes it doesn't leave me with the ideal tissue that I can use to get you the best result. But if you're in pain, swollen, infected, then that whole theory of me wanting to do it goes out the window, and you've got to go get that tooth out first. And then so we're going to get to the price at the end. Are your implants zirconia? The teeth are zirconia, the bridges, but the implants are not. The implants are titanium. So they do make a zirconia implant. I'm not on board. I keep up with all, as a board certified surgeon, we keep up with all the newest, latest, and greatest things that are coming out and are out. I'm not sold on zirconia implants yet. I think there's a place for them, but not with these full arch bridges yet. Zirconia is a very strong material, but when you're putting force in certain areas, I've read where they can fracture, and I'm just not ready to put my patients through using zirconia implants at this point. All right, I was late signing on. Can I get a transcript of the session? Yes, we'll have. So Keith, I assume Keith is going to be typing some of these answers. But yes, so all these webinars are uploaded to YouTube, and you can find the link on our website. So you can see these even if you've logged on late. And yeah, most of these other questions we have addressed. So basically, whether you have no teeth, some teeth, a few teeth, 2 teeth, all your teeth, you're a candidate for this procedure. And then so recovery, this is a good question. Can we expect a lot of bruising? It just depends. Everyone's different. I used to tell patients that, if you partake in alcohol, 2, 3, 4 times a week, especially red wines. If you're on a blood thinner, you take baby aspirin every day, then I would tell you like, hey, you're probably going to get some swelling and bruising. And then I would have a patient that is a younger, healthier patient, not a drinker, not a smoker, not on any blood thinners, and they come in after, a week after surgery and they look like a pumpkin, like they've been in the ring with Mike Tyson, not when he was fighting Jake Paul, like back in the day. And so it just depends. We're all different, and what I would tell you is my protocol is just rest for the first 2 or 3 days after surgery, sleep with your head propped up if you can, and live for the first 2 or 3 days with ice packs on your face. And we give you a lot of other post-operative instructions to do, things to do and things not to do that usually help out with some swelling and bruising. And then what if you only gag with teeth, only a few of those on the bottom? So the beautiful thing about these fixed teeth, they don't move, and they really never are in a position to stimulate your gag reflex. So that's typically not a problem. All right, so we're going to go through some more of the slides because I've got some things that I really want to share with you guys. And what I was talking about before and after, we've got actually some testimonials. So you're going to hear from some of the patients that I've actually treated with this procedure. And they go through and they'll probably answer a lot of your questions that you have just when you hear their stories. So this is Michelle. She is going to describe her journey here with us at New Teeth Now, and I'm going to let her rock and roll.
Thanks to New Teeth Now, I can smile and I can live a healthy life. Today I got my final teeth in and I am so excited. I can't wait. I would never eat with my front teeth. Everything was either broken into pieces and put to the side. I would never bite into anything because whenever I did, they would wiggle and feel loose, so I was afraid to do that. I had loose teeth, periodontal disease, and I knew that I couldn't do dentures. I knew that I wouldn't be comfortable in them. I would never be happy. I had been to other dentists, and they had told me within 5 years you're going to lose all your teeth, and you have no bone to support your teeth. I researched, and New Teeth Now came up on my computer, and I was reading about the Zygomatic Implants. All I heard was it's good for no bone. I said, I think this is the place we need to go. When I met with Dr. Kirkpatrick at my consultation, made me feel very comfortable in this decision that I was making to change my life. I went in, I woke up a few hours later. Relatively easy, I guess you could say, because I don't remember it. But believe it or not, I did not have any pain, none. I myself was shocked, and I was the one going through it. I think I held the mirror at New Teeth Now for like 20 minutes, and when they took it away, I said, no, give it back. New Teeth Now changed my life in one day. My doctor believed that getting rid of my teeth and my periodontal disease had a major, major factor in my health being what it is now. She's like, if I could call New Teeth Now, I would personally. If you have periodontal disease, loose teeth, bad oral health, just make a phone call and go to the consultation. And it will definitely change your life, but you have to make the first phone call. It's life-changing, it's amazing. I couldn't be happier right now.
All right, so you can see, her after smile, and it's really cool to see the difference. And then you guys heard her talk about her journey and how it's affected her and changed her life. And that's really what we try to do here. And there were a couple of good questions come in right before the video started, and I do want to address a couple of those. One, it says, I've seen a lot of advertisements for full mouth implants, and all the teeth are the same length, which don't always look real. Do you vary the size of the teeth? So yes. So when I was talking about earlier that the teeth are custom, some people come in and they want them to look just perfectly straight across, everything the same level, easy to do. Some people come in, they want them to be a little bit, have some character and make them look more natural. That's easy to do. We can do that. And one of the things that we do here, which goes into another question that we got, which is probably one of the most important questions that I've heard a patient ask on one of these webinars. And this patient's probably been to a consult, I would guess, somewhere else. But it said, do your gums shrink after the surgery? If so, will I have to follow up in a few months for a readjustment? That is one of the things that I talk about in the consult. And I'm a huge believer in don't trust everything I say. I'm going to tell you exactly what I think from my experience. But you need to really have a good feeling with me, this procedure, and you need to be ready to commit to this because there's no going back from it. You know, if you have all your teeth, I'm taking them all out. Everything's coming out. So you have to be ready to make that decision. And when you do that, you got to be ready who's going to do that and where you're doing it at. And there's a lot of, on webinars, I've used the term, there's a lot of wannabes out there that try to do this procedure. We've been doing this for a long time here. And, you know, it kind of, when we first started doing it, even in the dental world, we'd have dentists call us and they would say, hey, you know, I'm seeing Mrs. Jones and she told me she came there for a consult. Like, can you guys really do what you told her you could do? And me and my partners were talking and they're like, you're a general dentist, like you don't know this? And they didn't. And this was back, you know, when doing this a New Teeth Now procedure where we were replacing everything, it wasn't a really like a brand new procedure, but a lot of general dentists didn't know about it, and it really wasn't accepted, I guess, in the general dental world, because in that world, and even when I went through dental school before surgical residency, it was almost, they teach you in dental school, it's like almost a mortal sin to take a tooth out. If there's decay, you drill it, you fill it. If decay comes back, you crown it. If it comes back again underneath the crown, then you take the crown off, you do a root canal, and you put another crown. And you might even try a second root canal if there's still a problem. You do everything you can except take the tooth out. It's only when there's no other option you take the tooth out. That thought process, thankfully, is out the door, and it should be, because when you do all that with a tooth and you're kind of prolonging the inevitable, then all you do, it's almost like watchful neglect. You're watching that bone get traumatized with all those procedures, and the bone just starts shrinking away. Then you need the zygomatic implants. And you know, when we can attack it before that happens, then sometimes it's a whole lot easier for me and you as the patient to do this procedure. And don't get me wrong, I'm not saying that you shouldn't try to save your teeth. You should absolutely do that. No one has anything that's as good as your natural teeth if they're good natural teeth, and they can be saved with a good prognosis. But if they can't, then you really need to think about like when you make that decision to jump into a procedure like this. So the question was, do your gums shrink after surgery? When all the other kind of wannabe clinics start popping up, because now they know patients are really smart. So we've started we've been advertising for years, and it's kind of name recognition. Now a lot of patients know about this procedure. And a lot of that is because of the advertising we've done over the years. But what happens is these clinics pop up now because they're like, well, I mean, we need to jump on their coattails, and I want to try to do this procedure. And they do it, and some do a good job, some do not do a good job. And there's some clinics that will even market, and they've targeted me with ads on Facebook and Instagram. I guess they think I need the implants, and one day I may, but currently I do not. But their ad targeted, and it really kind of almost attacked us by saying that there's some people that make you wait 6 months before you get your final teeth. We do your procedure and either give you your final teeth the next day or like within the first week. That sounds great. If you're kind of in the dark with implants and really how this system works, it sounds great to me too. But the more you know, and especially if you come for different consults, then you'll hear and you'll figure out that that's by far not the best thing to do, because your gums will shrink and you will get a space and you will not be happy with that to be your final teeth. So what we do is we put on, teeth that you leave with that surgery day. We change those out in a couple weeks after surgery for zirconia, which is like your final material. And as far as I know, there's no one else in the country doing that for temporaries. So zirconia, patients love it. We've started doing that a couple years ago. Patients love it. The gum heals very well to the zirconia. And then we don't have to deal with, the major reason that we started doing that is because we'd have out-of-state patients coming in or out of country to do this procedure, and they would be wearing like an acrylic or more of a printed set of teeth until they got into their final teeth 6 months later, and they occasionally break or chip. And it was always on a Friday night, and they're in another state, and they call our answering service, and they'll say, hey, my front tooth broke off. And I'm on the phone, sometimes over like FaceTime, trying to guide them on how to put a drop of super glue and stick that tooth back on until they can come back to Florida or come to see me to have our lab fix that. So we moved patients into temporary zirconia, and it's been one of the best decisions we've ever done for us, because we don't have to deal with those breakages anymore, but the patients love it because they love the feel of the zirconia, the look of the zirconia, and they're super strong and they heal better on the gums. But that's not the end. So that's not your final set, even though it's the final material. We still wait the 5 to 6 months after surgery and let your body go through the process that it goes through during the recovery, and your gums shrink. You're going to get that space in between your gums and the bridge, and we make a new set of zirconia that now gets made to go up and close that space, and it's a brand new zirconia bridge. There's nothing added to it. And that's what these other clinics do, and that's where you need to really be careful and think about who's going to be doing this procedure to you. When I talk about being a board-certified oral surgeon, super important. Most of these people are not. They're fly-by-night implant. They call themselves an implant surgeon. There's no such thing. There's not a specialty called an implant surgical specialist. There's a board-certified oral surgeon. There's a periodontist who they can put in implants. There's general dentists that put in implants. And you got to be very careful on who's doing your procedure, and you've got to be really careful on if they say, hey, we're going to do your final teeth the next day, okay, sounds great. But when your gums shrink, which they 100% guarantee they will, and you don't like that space, they'll say, oh, well, come in and we'll kind of close that space. And what they do is they layer composite on top of the zirconia. And how do I know that? Because I've seen it, and we actually have hired some people from some of these other clinics, and they tell us that. But it's a horrible thing to do because it doesn't stick there forever. It looks great, feels great right away. But 2 or 3 years down the road, that stuff starts chipping off, and then it's gone. Then you got to go back in, and guess what? A year or two down the road, now you're paying to have it fixed again. Where here, you're getting that one-piece zirconia bridge that's made to custom fit your gums when they've healed, and that's how you get the best final result. That's more of a more permanent, where you're finished with that procedure. So I'm glad you asked that question. The other question that I want to address before I get to the next slide is someone asked about, do I treat diabetics all the time? So diabetes is definitely not a contraindication for implants. We do look at your history though. So we get blood work, EKG pretty much on everyone, any medical clearances that we need to get from either, if you have a cardiologist or a pulmonologist or any other specialist, we're definitely speaking with them, sending them a letter to let them know what we're doing and making sure that we're doing everything in the safest way possible. If you're a diabetic, I look at your trend and we do an A1C. There's guidelines on implants and A1C level. If you're an A1C of an 8 or above, then we kind of coach you on how to lower that A1C because it needs to be below 8 when you do this procedure, because otherwise there is a higher risk of implant failure with a high A1C. So it's a great question. All right, so who's a candidate for this? So we've kind of talked about this, and if you have no teeth or you're unhappy with your dentures, definitely you're a candidate. Mouthful of bad teeth, severe periodontal disease, and if you've ever been told that you do not have enough bone for implants, definitely take the time to call the number, go to the website, schedule a consult. It doesn't really cost you anything to come in to see me. We take a CT scan and we can talk about and see if you do have enough bone for implants. And like I said at the beginning of the webinar, I have yet to meet a patient that I could not do this procedure on because they didn't have enough bone. The only time I haven't been able to do this procedure is for some medical reason. They had, a significant amount of radiation to the head and neck because of a cancer in the past. That can really do some things to the jaws where the implants may not be appropriate to place. Just, kind of one-off things like that would prevent you from getting the implants, but not bone. So once again, these key differentiators, I'm putting this slide up here again, and I actually may put it up here again, but just it's super important because the board certified oral surgeon, I've kind of ran that in the ground. The zygomatic implants, if you don't have enough bone for implants, the zygomatic implants are the way to go to ensure you get a very good solid foundation for your bridge, and doing it under general anesthesia, the safest, most comfortable way that a patient can undergo this procedure. So our coordinators, if you do come to see me, it's Shauna, Chastity, and Allie. Each of these three young ladies have been here in Lakeland with us for a long time. And, they've all been, actually all of them have been assistants. So they've been in the room when this procedure is going on, and they've seen the procedure, so they have just a significant amount of knowledge about it. And usually when I come in the room and you've already spent like 20, 30 minutes with one of these young ladies, they've already answered most of your questions. And, I'll come in and I'll say something and the patient will look at me like, oh yeah, like Shauna has already told me that, or Allie went over that, Chastity kind of went through that already with me. And I'm like, well then, do you really even need me in here? Or they've stole my thunder. But that's really good because I know that when a patient comes in for a consult here, and we hear this all the time, that if patients have been other places for a couple consults, and then they come here, they meet with one of my coordinators, and I go over everything with you, and I show you your CT scan, I show you how much bone you've got, where your bone is, and how I'm putting the implants in. Patients will be like, man, nobody, like I've been to several other consults and opinions, but no one went over, like I had no idea this is what you'd be doing and kind of how you'd be putting these implants in. I didn't know where my bone was. They just told me that, hey, here's how much it's cost and they could do it. And I really want you to know what's going on so you can make an informed decision if you think this is the right procedure for you. So the restorative team, we've got Dr. Nafala, Dr. Dibbs. Both of these guys I've been working with for years. They have been doing this for, more than 12 years apiece. And between them, I would say, I would be willing to bet money that between these two guys in a year's time, there's no one else in the country, and you could probably combine a bunch of other offices and they wouldn't come close to doing as many of these, making the teeth for patients as these two guys have done, which is very important when you think about who's going to be making your teeth. On the implants that I've put in, you want someone who's kind of been there, done that, and seen everything to get you in the best fitting bridge that's possible. And I think Dr. Dibbs is going to talk about a little, his experience of being here with us for over, a good amount of time, and his experience with having the lab here on site and everything under one roof.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. We need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
Okay, so here are my surgical assistants, and if you come here, you'll definitely get to know these three young ladies, Ashley, Monica, and Amanda, and they have been here with me doing this procedure, multiple procedures. So they kind of usually, I joke around with them quite a bit, but they typically stay like a step ahead of me. So when I'm ready to do something, I pretty much turn around and on my surgical tray or just the process or the steps that we're on in the procedure, they're already there and they're ready for the next step. Which makes it very efficient and safe, and where we can get like I said, the best result we can for our patients. The process, I know there's a couple questions on here about, like, well, what transpires if I want to come there so the first visit is the consult, and then that's where you meet with me and one of the implant coordinators. Then there's one more appointment in between that and your surgery. Sometimes we change that around a little bit if a patient's from out of state or out of the country, but that next appointment is for the pre-op and impressions. So when we get those impressions or scan your mouth, that's what we use to make the temporary teeth, which I use in surgery to guide me on the implant placement. And that's what we put in at the end of the day for your temporaries. And then I usually would see you back about a week after surgery for a post-op appointment just to make sure everything's healing okay, make sure you're doing okay. And then we scan everything inside your mouth, which is super fast, super easy. It's just a little camera that we stick in and kind of run it across the teeth and then have you to close down. And we scan where you're happy closing. And that's what we use to make your temporary zirconia teeth, which we then place about a week or two after that. And then it's up, you kind of wear those for the 5 to 6 months, come back for your final teeth, and then it goes on to regular care and maintenance. And there was a question on that, like what is the maintenance on these? And it's pretty much the same thing as it is with me with my natural teeth. You go to the dentist every 6 months to have them professionally cleaned. Anything that cannot come out and you wash under a sink, you really need to go get professionally cleaned. We include 2 years of cleanings with this procedure. It's just like it's all included in the whole package price. But the reason we do that is not that we want you to have to keep coming back here. We want to educate you, and we want you to learn how your teeth should be cared for and should be cleaned. So if you move from, if you live in Orlando and you come see me for this procedure, and you move to Seattle and you start seeing another dentist there, it's not necessary for you to come all the way back to Florida every 6 months. We'd love for you to see you and follow you and make sure that you're like everything's doing well. But you can see a dentist there who's, very, knowledgeable with implants, but we want you to know what to expect. So we want your teeth taken out every 6 months so they can clean it in the ultrasonic cleaner, check your gums, put them back in. It takes 15 minutes, super quick, super easy. If they're not doing that, find another dentist, and we can help you through some of our implant reps, find a dentist in your area to make sure that you're taken care of. And then one lady asked, I'm going to address this question too. In my opinion, does zirconia teeth look better than nano teeth? So the nano ceramics, they kind of came out and everybody thought that it was going to be this new, latest, greatest technology to make these bridges, and it'd make zirconia go away. It wasn't even close. To me, they stain easier. They don't look cosmetically as good. And we looked at them, and it's just right away you could tell that we weren't going to use them. It's not a good product. It's a little cheaper, and it's just not going. My goal with every patient is I never want to have to operate on you again, and I want this to be the end game for your oral care. So you need to maintain them, but I don't want you to need me. I don't ever want to have to operate on you again, and I definitely don't want to have to make you another bridge, or you go have another bridge made somewhere. Zirconia is super strong. It's the strongest product that we know of that's out, and it should last you decades and decades and decades. So this patient, actually I've not had the opportunity to see this video. It was just completed today, but Mike is one of my patients, as are all the other patients that you've seen tonight. And he's kind of special patient to me because he's kind of recent, but he was extremely terrified of a dentist, which led to how you see the appearance of his before here. And we see a lot of patients that truly do have a fear of either going to the dentist or coming in for a procedure like this and seeing, me or another oral surgeon. And, he came in, he had no-showed for a couple appointments, and then he came in, I did see him, we talked through it, and he was ready to go. So we scheduled him for his surgery, and I'm in kind of getting things ready in the operating room. And he was here, came into the restroom. They'd given him the little gown to change into. And next thing I know, he's nowhere to be seen. And one of my assistants said, he came back out, handed me the gown still folded up, and said, I can't do this. And he walked out. And I was like, wait, what? So I go outside, and because I really felt that he needed this procedure, he wanted this procedure. So I walked out, and he was still sitting in his car. He just put his truck in reverse, and he saw me walking out, so he put it in park, rolled his window down, and he just kind of put his head down. He's like, I can't do it. So I asked him what was going on, talked to him for a little bit, and ultimately he walked in with me, and we did the procedure, which I was very happy for him. And when you see his after picture and you see his video, you can see it was a big decision for him, and he got a great result, and now he's super happy and very, very glad that he did this procedure. Really good question. And I actually had a patient. He was very, very anxious. One of the things he did, he got online the night before his surgery, watched a zygomatic implant procedure, and he no-showed the next day. He stood me up He literally
Can't watch
stood
those
me up.
videos.
I'm here, I'm ready, the team's ready, we've got the room ready, anesthesia team's here, and there's no patient.
And
He couldn't believe you stood him up.
yeah, and I stood him up. I stood him up. He could have kicked me to the curb, but he didn't. And I'm very thankful that Dr. Kirkpatrick did not do that. Because I'm here today smiling
With your new teeth now.
with my new teeth now. Then I was diagnosed with periodontal disease, and I basically gave up. That's when things started going bad. Quick. They were just falling out of my head. When I held my grandson, he's 2 years old, he would look up at my mouth, and he would look down and shy away. My mouth scared him, and I knew I had to do something.
He actually found Dr. Kirkpatrick and new teeth now, but I knew that his anxiety was still going to be a problem.
And he looked over my CT scan, and he explained everything to me so I can understand. I was impressed. I felt comfortable with him, and when we left, I was excited. For the first time, excited to get this finally behind me. Well, we went through the consultation, everything went great, and the day of surgery, I was nervous. And at 7 o'clock, when I was due to be there, we called. I canceled an hour before I was supposed to be there. And I felt horrible, but I saw the next webinar, and he was telling my story.
And one of the things that scared him was he watched a video of, some clown trying to place a zygomatic implant that probably had no business doing that. And it's nothing like what you would experience here.
But we called back, and they put me back on the schedule. Day of surgery. I went into the bathroom, they gave me my gown to change into, and I started having a panic attack. I went up to the waiting room, grabbed Debbie. We have to go. So she's all confused, not knowing what's going on, and we get in the car, and I was like, I just need to get out of here. And I look up, here comes Dr. Kirkpatrick out the side door, looking all confused and concerned, and he said, what's going on? I was like, I'm just having a panic attack. I can't do it today. He's like, well, come out here and talk to me.
You're already here.
You're already here. So I get out, talk to him. He's like, you need to do this procedure, but I will walk you through everything. I got you.
For a doctor or a dentist to come out to your vehicle and walk you back in somewhere,
Yeah.
not because they want the money, not because they want anything other than what's best for them.
He really cared. He really cared. And I
He
trust.
showed how much he cared.
Yeah.
Nobody has ever done that before. I love him. I think he's great. I think he really cares about his patients.
He does.
And I wouldn't have this today if it weren't for him.
Absolutely. Absolutely.
I think that it's better for so many different things. I mean, you get more kisses, you get more hugs, you get more talking, you get more smiles, you get better pictures. I mean, definitely changes so many things.
We go out to dinner. We're more active with the family and friends, and I feel comfortable. I'm happy. I feel great. And I'm excited about the future. And I can't wait to start traveling with my wife.
You have everything to gain.
Absolutely.
And new teeth now, you get it the same day. You get a doctor that really cares.
And they don't treat you like a number.
No.
They treat you like a person. And that's what you get at New Teeth now.
Well, okay, so that's the first time I've seen that video. I'm glad, Keith did put the camera on me. So no, that is pretty touching, and that's really how it happened, and it's not been that long ago. So you saw him in those, he held up a mirror and smiled, and that's kind of the surgical teeth, the printed teeth that you get the day of surgery. But the one where he was doing the video and smiling, the teeth that looked better, those are the temporary zirconia teeth. So he's still in his temporaries. He hadn't healed yet completely, and we're still waiting on the bone to fuse to the implants. And then he's going to start transitioning into his final set of teeth that will have a little bit more custom fit to his new happy, healthy gum level that he'll be happy with for decades down the road. So there's a couple other questions. One person asked, and I'll kind of summarize it, but pretty much if I've got a bunch of bone loss, are the teeth made bigger or taller to compensate for that bone loss? Not necessarily the teeth, but the bridge. So we don't want to make it where you look like you've got like Mr. Ed teeth or gigantic teeth. We want the teeth to still look really good, but we do make the bridge just taller, which would be more the gum part of the bridge, to compensate and replace any bone that you've lost. Because if you've lost that bone and we make just the teeth to go there, then you're going to close your jaw and you're still going to look like you have no teeth, because it's going to be so far up and underneath the upper lip or below the lower lip that you'll have a hard time even getting your jaws to close that far, because there's a certain space and vertical height that your lower jaw is happy closing to. So we set everything and try to maintain that, which makes you look a little younger because it replaces the volume you've lost in the mid-face and the lower face, but it puts the teeth in a really stable position, so it protects your TMJs, your jaw joints, over the years. And so yes, it definitely works with bone loss. And why do some people lisp after the implants? Well, there's a couple reasons. Usually there's a little transition phase where you got to adapt to these, but most of our patients do really well. And we usually would coach you or give you some things to do, but most of our patients come back, and even that are temporary teeth, they're just rolling right along with it. The only time I really see a patient have any type of lisp or they have to really focus and think about, you can tell they're concentrating, like when they're speaking back to me, is when they've developed that space that I'm telling you about, that's over time, that, you know, these other people that are doing final teeth the next day or that same week, that's what they leave these patients with. And it's going to be that space where air can escape over it and it can affect your speech a little bit. But that's there just temporarily until we get you into your final teeth after your gums have settled and healed. But that is a good question. So the resources, we've got several, and we try to overload you on social media and our website and these webinars, and to tempt you to come in for a consult so you can get as much information as you can. But we've got, Facebook pages, Instagram, YouTube, TikTok, and, our New Teeth Now website, of course. But we also created, our marketing and advertising team did a really cool thing that I think for patients to really get on and kind of get the lowdown of what if you're wanting to ask like very specific questions, or you want an answer that's from someone other than, one of our, like me as the surgeon or one of my coordinators, then we've got this New Teeth Now community page. And you can go on this page and you can actually talk to patients who are thinking about the procedure, talk to patients who've been to other places for consults. And it's just it's almost like a social media platform for people who've had the procedure, thinking about the procedure, or have any other question about it. And I mean, you can get on here and maybe sell your car. I don't know. They may take that down if you put it on there, but it's a pretty cool site. I've been on it several times, or someone in my office or my family or a friend will send me a question or a comment that a patient made, and they're really good. And sometimes there's some negativity on here, but we want that. I mean, we'll embrace that, because if a patient's had a bad experience with us or somewhere else, I mean, I want to hear it, and to hear it on that, and then you get to see it, and we can answer and kind of answer questions and talk about some of the comments. But I think it's a really cool thing that our marketing and advertising team created for a good patient resource. Thank you guys for being on here. And if you have any questions or they pop up, definitely go to newteethnow.com and call the number on the bottom of the screen. I'd love to hear from you and see you for a consult. Thank you guys.